let's start off with a quote. This is pretty recent. This is happening this morning. So Dale Sanders, president of technology with Health Catalyst, had this to say on LinkedIn this morning, roughly 35 minutes ago. If and when I ever return to the CIO role in healthcare, I'll race as fast as possible to move my data centers to the public cloud. There's no way I can provide the same capabilities on any dimension with my data center. Even the data centers like Via West can't come close to matching Azure, AWS, et cetera. And I think it's interesting. I think you're seeing a lot of, John Halamka had on the show also had similar comments about the capabilities and things that are available in the cloud. So let me set this up. So let me put a little definition around it. I came in as CIO in 2010. I looked at the organization, looked at Rob, and said, we're going to, here are the characteristics of cloud that we're looking for. And this was back in 2010. Not a perfect definition, but it sets the groundwork. We said it has 5 characteristics. First, self-service provisioning from anywhere. So web-based provisioning really from your phone, from Alexa, from self-service provisioning from anywhere. That was number 1. Number 2, rapid elasticity, which meant you could scale up and scale down. Now, scaling up was not that big of a deal back then, but it was somewhat. Sometimes you had to add crack units and air conditioning and power to your data center, in which case it was millions of dollars. Other times you had to add servers, took a lot of time. But one of the things that we were looking at when I came in 2010 was the ability to scale down. We kept asking the organization for tens of millions of dollars for new data centers and whatnot. And they were saying, okay, hey, we're actually selling off portions of our business. Can we have some of that money back? And the answer is no. So cloud gives you the ability for self-service provisioning and rapid elasticity. So scale up, scale down. Meter service, pay for what you use. So one of the benefits of the cloud is if you have 1,000 users today, you pay for 1,000 users. If you have 800, you're paying for 800. But even more than that, the services are much more granular. So you're only paying for the storage you need and the compute you need. And now it goes all the way down to AI and other things as well. The 4th thing was programmatic access to resources. This is where we get into the DevOps. This is where a lot of your efficiency comes in. And then the 5th thing was granular accounting, to the point where AWS now, you can do compute by the minute. So for those of you who are wondering what you would use that for, sometimes you have processing that's done at night. You could scale up 100 servers, use them for 10 minutes, do all your processing, scale them back down, and only pay for using those servers for 10 minutes. So granular accounting. So self-service provisioning, rapid elasticity, metered service, programmatic access to resources, and granular accounting. And like I said, that not a perfect definition, but it sort of set up what we were looking to accomplish. We were looking to get agility, efficiency, and automation within our health system.